Alright, my name is Zach Farmer. I want to thank you guys again for coming to watch my informative speech. More and more, our society views winning as something more important than the game itself. Success and competition bring status, popularity, and fame, not to mention college scholarships. Today's athletes are looking for more an advantage over competition that will help make them winners. Unfortunately, the adolescents of today are caught up in this high-stakes competition frenzy. Because of this reality, teenage use of performance-enhancing drugs is growing ever more popular. Performance-enhancing drugs can be regarded in four classes: androstenedione, creatine, anabolic steroids, and alkaloids. All of these drugs are available over the counter with the exception of anabolic steroid class. Since 1994, these nutritional supplements are no longer controlled by the FDA. As a result, there is no control over their purity, efficiency, or distribution. In fact, most of these substances market themselves to the general public as safe and natural. Creatine, a protein, is a very popular nutritional supplement sold as fine white powder. It is important not to confuse this chemical with creatinine. This protein is synthesized in the liver at a rate of 1 to 2 grams per day. Creatine is also found in red meats and in some fish. Most individuals need about 2 grams per day. In our skeletal muscle, creatine plays an important role in the production of ATP. The goal of this nutritional supplement is to provide the muscles with large stores of creatine for maximal exertion. Far and away, creatine is the most commonly used nutritional supplement among high school athletes, with usage around 10% of adolescent athletes. Most athletes believe it increases their performance and decreases soreness after strenuous workouts. Adverse effects include weight gain secondary to water retention. GI distress is not uncommon. Increased cases of muscle tears upon maximal exertion have also been noted. The most concerning adverse effect is renal. Because creatine is a protein, it is known to raise serum levels of creatinine. The long-term effects of this response have not been studied in detail, but there certainly is the possibility of renal dysfunction. At a minimum, the athlete of this supplement needs to be well hydrated. The androstenedione class of prohormones and creatine need to be studied further. Despite some earlier study that these classes of supplements more than likely will be determined to be even more dangerous in usage, and usage by adolescent athletes should be strongly discouraged. And that the andro class of drugs converts to testosterone in the liver. We have no reason to believe they are any safer than their predecessor, anabolic steroids.